Okay, so it's going to take longer than that to resolve your inner conflicts, but I'm going to try to keep the length of this video concise. So, what am I talking about? There's a lot of psychological theories out there, a lot of schools: CBT, self psychology, Freudian, and other kinds of psychoanalysis, analytical psychology, which is what I largely use because it's the best. And no, I'm not biased. Self psychology, Gestalt, EMDR, da 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 da. In fact, there's well over 500 different kinds of therapy in all, and all of them have what's called a transformational theory, which is the underlying theory of not only what is causing our distress, dysfunction, psychological pain, or whatever, but also how to get better. For example, the transformational theory of CBT is that our distress is caused by our maladaptive thoughts or cognitions. Notice here the essential equation of the mind as a clockwork machine in this model. Once we examine these thoughts through various means, then we can find which ones are causing us pain, and we can change our beliefs through various exercises, and voila, we're better. It's a way to go. It doesn't work perfectly for everyone and every solution, but it does work in some cases and very nicely. But the reality is that almost all therapies that have been studied are actually pretty effective, and they are equally so. This has been dubbed the so-called dodo bird effect. That meaning that in countless therapy comparison studies, CBT doesn't really fare any better than any other type of established psychotherapy theory. And this is according to an exhaustive account given by Wampold and Imel in their really fascinating book, The Great Psychology or Great Psychotherapy Debate. So, what do I recommend doing? Well, aside from getting help from a professional in this, the first thing you need to do is recognize what inner conflicts are causing your suffering. My transformational theory involves resolving inner conflicts, which are the source of your suffering. Well, it's not really mine, but it's the analytical psychology one. And this is called individuation in that theory, which is just a fancy way of saying inner unity. It's a goal where your mind is it's a goal that your mind is trying to accomplish anyway. It often needs the help of close analysis from the conscious ego. As we strive towards individuation, what we're doing is striving towards a balancing out, mediation, or integration of conflicting inner desires and attitudes. As you work on the story of you, in other words, the opposing sides of yourself can come together and the inner conflict will diffuse and you will outgrow it. Some examples. You might be miserable because of an ongoing struggle with addiction. So what's the inner conflict here? Spell it out. In this case, you have two conflicting people inside of you, metaphorically speaking, one who wants to use and one who doesn't. There's the conflict. Here's another example. Maybe you're stressed all the time by your romantic partner. Translate that suffering into an inner conflict that is behind it. The person within you who wants to stay in the relationship versus the person who wants to end the relationship. Or another example, maybe you're lonely and that's making you miserable. So what's the conflict here? Here, it's the person who wants more friends versus the person who is afraid to reach out due to fear of rejection. So there's a number of ways that you can bring the opposing forces together. Now, a warning, this process is not comfortable. It's not easy and it's not fun. That's why I recommend doing it with a trusted counselor or a helper. If this was easy, you would have done it already. Okay, so it's going to be challenging. But you're going to have to play objective mediator between the two people that you've identified in your inner conflict. It'll be on you to hear them plead their case with you. Remember, many times people attempt to resolve difficult inner conflicts by avoiding them, putting them off until later, distracting themselves. Don't let yourself do this. Listen to the part of you that wants to keep using, for example. Seriously, listen to it. Listen to why that person wants to keep using and all the reasons. Take notes if you have to. A therapist can help you identify unconscious reasons that are likely behind these too. That's why that's very helpful to have one. Then give the other side their just due. What are the reasons to abstain? What might be a good alternative to the needs and desires expressed by the other side that wants to use? And these other examples that I gave, you can do the same thing. Listen to the part of you that wants to stay in the relationship. What does this other person do for you? What commitments have you made to that person that you don't want to break? How do you feel about them outside of what they are doing to upset you? Then listen to the other side. Why might you want to end it? What happens if I do that? What often happens in this process is that you will wind up hosting a heated debate between the two sides. Let them talk it out. Don't rush it. Don't avoid it either. What about the loneliness example? Same kind of thing. Often these discussions will wind up in a risk-benefit trade-off or some other kind of trade-off. And newsflash, life rarely gives you anything without a trade-off, and you have to accept that. Then you go with the trade-off that is most acceptable to you. You may decide that reaching out, for example, is too risky, too terrifying, but then that means you have to accept the misery of being lonely. At the end of the day, you can either reach out or not reach out. You can't do both. And if you do neither, then you remain stuck in limbo, not deciding, which is just avoiding the inner conflict. And at the end of the day, you have to choose which one you're going to do with commitment and with clarity. Also, recognize the pain that you're feeling from a conflict is rarely due to the surface level thing that you think is really bothering you. For example, the addict may think that they want to use just because it's fun or whatever. But more often the addict is using as a way to avoid hurting, or they're avoiding a fear of some kind. This is the time to really explore that. What is hurting? Is it trauma, betrayal, anxiety? What are you trying to avoid with this? If you discover that, then the inner conversation will shift. And now you're talking about how one part of you wants to alleviate that inner pain by using versus the person who doesn't want to use. As you can see, these two parts are slowly coming together in this instance to work as a team to find out the solution to the pain. Both of them don't want that. The pain that the drug is just covering up. Note that this process can take weeks or even months, sometimes even years if it's a really, really deep, difficult conflict and you're presented with two choices that are seemingly irreconcilable on the surface. And not to mention that the conflicts can resurface if you're under other stress later in life through other things. Roll with it when that happens. Don't panic. It's to be expected. When you get good at this, you'll be ready for the challenge if it happens. But it's like physical therapy. It's painful and your gains will be minimal at first, and life won't stop throwing you curveballs in the meantime. But with persistence and practice, this process will improve and you'll get better and better and ready to face the next challenge. See you next time.